Hi, I'm Dr. Matson. Today we're going to be covering Chapter 9 in the Population for Health for Nurses textbook in the OpenStax textbook. And the topic we're focusing on is planning community health education. So as an overview, we're going to talk about principles of planning and health education practice and developing a health education plan, as well as the different steps that are involved in these activities. So your goals for the end of this are to be able to really identify the importance of health education and talk about the different principles and education practices, as well as the significance to that needs assessment and planning process. So for community health education, the process of providing information regarding optimal health and wellness at a community level is really health education. So community health educators work with local schools, government agencies, health departments, and other community agencies to really identify these health needs. And education is instrumental in assisting the learner and in making changes towards a healthier lifestyle. So each community may have a different version of health education because their particular needs determine the education program that they need. So education and health are really connected symbiotically. Education increases awareness of health issues, and it also provides a method to prevent health complications by identifying health concerns early. So as a community health education provider, there are places and powers that help make these informed decisions. So as a nurse, really positioned to help increase the knowledge and the method in which this is communicated to the community to improve all of this health wellness as well as disease prevention. So here you're looking at a graph and it's talking about principles of health planning and education. So on the top we can see all of the contextual factors. So this is really being informed by your community assessment. And then we know that the social policies and the individual characteristics of family are really shaping how education and health go together. So we can see that there is really a direct link between education and health outcomes. So in education, we want to look at attendance, concentration, and any kind of learning disabilities, or you can even think of this in terms of barriers. And then through this education, this creates an opportunity. So then from health, there's an increase perhaps in income and resources. The higher level of education we see, the higher health outcomes we see. And then we have this increase in healthy behaviors, societal benefits, and psychological benefits, and healthier neighborhoods. And then we can see this then go in turn where poor health can put education at risk. So if someone is not able to, physically be present perhaps, or have any of the resources that allows them to get to this education, or understand it, or even be in a place to receive it, then that will mean that they might have low attendance, concentration, and barriers to learning. And then you can see this continual cycle that we can see when we're out there in the communities trying to educate on health. So you guys have done this, a community health needs assessment, right? We're looking at the resources and current needs, and this is because it's helping us identify that need and then also really tailor our intervention and potentially our education, right? And so we want to concern ourselves as nurses with who is the learner, what are their interests and motivation, and create educational activities that really make people a stakeholder in this, that they're part of it. And the more that they're involved, the higher they are, higher the likelihood that they'll participate and accept it. So the nurse and healthcare team really needs to remain flexible, be ready to modify any plans as needed. And this could be due to a change in resources or a change in problems or even how it's being received. So a successful health education program is holistic, it's intersectional, people are participating, it's equitable, and it's based on a theoretical framework and model. So now we're going to be looking at these models and how we can use them to develop an education plan. We're going to be thinking about the different perspectives of individuals, families, and communities and systems, as well as looking at evidence-based teaching strategies, considering the health literacy level and the hearing and cultural sensitivity. We're going to put this Maslow's hierarchy of needs in context of developing a health education plan. So Maslow's hierarchy of needs begins with the foundation of the most basic needs. So we're thinking food, water, warmth, shelter. So then it moves up from there, right? Different higher levels to self-actualization. And when we think about this in terms of self-actualization or in context of health, and we're starting at these basic needs, then we can be implementing education within the community depending on kind of the level where someone is, right? So if you're trying to educate them on staying healthy, but they don't have food, water, shelter, or warmth, then they're not going to be able to even accept that education because they don't even have the basic things first, right? So maybe that means that we need to first figure out, how do we get the community's food, right? How do we educate them maybe on, here are where the various shelters are, here are where the various food banks are on the days of the week that perhaps they're closed. Here's alternative. Here's how you get signed up for food stamps, right? So that education may be first focused on this very foundational level, if that is primarily the need based on your needs assessment. From there, we're talking about safety, employment, and assets, and this feeling of security, right? So the education in this point, if someone is needing this met, right, maybe we're helping them figure out how they can get stable housing and a job, and then from there inform them on health benefits, clinics, things of that nature. Beyond that, maybe now we can address some of the psychological burdens, perhaps anxiety, loneliness, depression, and help promote this sense of belonging and intimacy and look at the family context. And then really build on this self-worth and a confidence and accomplishment from that point. And this may be where now we can start talking to them about exercise and health promotion activities. And then from there, that inner fulfillment and really the best possible health that they can achieve. So we have to understand what level the community's needs are, and then educate based on that, and then from there plan our intervention. And we do this by using a number of theories. So we've talked about these, and just to make this even clearer, we want to provide a foundation for education programs and really help people understand how to learn. So these theories are often used in developing the education plan, like behaviorism, social cognitive learning theory, constructivism, humanism, adult learning theory, and connectivism. So we use these to guide our interventions so that they're evidence-based, they're purposeful, and we know that they're going to be more effective because they're following these methods that have been shown to be efficacious within these contexts. So when developing these education materials, we need to look at both the developmental level, the peer influence, the learning preference, previous experiences, health literacy. Again, we want to think about this in terms of no higher than a 6th grade reading level, and what the social cultural factors are. We also want to take into account the policy and practices, maybe of the healthcare context that they're in, maybe the school that they're in, and also the preferred language. For cultural sensitivity, we need to be aware of the culture. And if we're not, we need to ask the right questions. Because if we're educating, let's say, and as an example, a community that is against whatever health practice it is that we're trying to promote, then it's not going to work and it's going to break down trust. So instead, we need to ask questions, right? And then try to promote health within that context while respecting culture. So, for example, if someone is experiencing, let's say, endometriosis, right, and their healthcare provider is only telling them that they can be on contraceptive, but perhaps their faith-based or cultural-based affiliation says no to contraception, then that is never going to work. And they're going to be in pain and feel isolated and not heard. So instead, let's understand first, okay, what is it, the shared decision making, what is important to you? Please tell me a little bit more about this so I can understand. And then we can start to shape, okay, understand you're not going to want to do contraceptive. Do you want to start with exercise that's been shown to help, or perhaps are you thinking along the lines of surgery? So we can just communicate with people and then start to develop a plan and an education plan with them. And then we also have to think about educating the whole families. So this is done not only in schools, although we can see this more in elementary, right, school-based, but throughout the continuum. We think about cultural too. There could be multiple generations living at home. These different generations could be influencing health practices and trust of the healthcare providers. So when we're developing a strategy, we need to think about this in terms of all the group members within this family context and how we can do an education or learning environment that spans the whole family, and be able to have them be part of what is happening. So education at the community level is normally large scale. We can think about media used to really disseminate or share these educational materials, and trying to think about this in terms of not just singling out an individual, but thinking about it, can this work within this multi-generational context? So the goal of the nursing education needs to be established from the beginning and then during these planning steps. And this really helps formulate the objectives to know, did we meet what we said we were going to meet in our targeted education material and goal? And when we look for educational criteria materials or develop them, we want to see what resources have been proven effective. We need to look at the evidence. This needs to be evidence-based health education. This is what allows you, one, to protect your license, but also to give the most accurate health information to the communities and really keep that trust up. So it should be in a published journal or a national state website dedicated to public health. And this could be through agencies that are providing health services or experts who work in this field in public health education. The CDC provides resources as well. Okay, now we're going to talk about the 6 steps of planning health education. Think about how to develop that education plan and strategies to enhance communication. So by the end here, you should be able to be familiar with these and then use these steps when developing your education plan. So first, we want to identify the learning needs. This is done through the stakeholder interviews, surveys, talking to the community, and then really develop the established goal and objective. From there, you want to be able to select the appropriate materials. So this is coming back to number 1, right? So through that community health assessment, you should be knowing kind of the appropriate level. And then you're going to design and implement your educational program and then evaluate if this program or process was effective. So if you do pre and post surveys, that's a very good way to determine if that learning has improved, right? The understanding has improved, knowledge, attitudes, beliefs have changed. And then always, it's a learning process. There's no perfect education plan that is brought out the first time. This takes iteration, multiple attempts. It may change a little bit slightly depending on if the community changes from time to time. So what we have to do is evaluate. Did it work? Did it not work? What are we going to do better in the future? And then do we need to make any revisions based on that? So really, when we think about this, once your team has established these goals and objectives, you also want to be thinking about your learning theory. So we've talked about those and you want to be establishing that and really putting those into these teaching strategies and overall learning format. And then see if you need to change any kind of education plan based on that as well. So teaching methods, we have to take into consideration the population, and then what are the barriers. So if we do this education plan, we're following our framework, we've identified the need, what could potentially be, standing in the way for that learning to be received, even with all those other things in place. If we're able to anticipate that or adapt based on that the learning is going to be more effective. So we also think about education in the community. It involves an entire team. It means that we're looking at this interdisciplinary, diverse group of professionals. This could be nurses, pharmacists, physicians, community health workers, teachers, even the fire department. This could really be a huge span of different professions that are out there trying to improve the health of the community. And if there is poor communication, we know that, increases medical errors and death in the United States, but also it breaks down trust and takes away from this educational content, and then we see health decline. There are team approaches like STEPS, which improve teamwork and communication. So here are the STEPS framework, and this is really a guide for an effective, patient-based team. So we have the patient or the client in the middle, that care team. And then around this could be simulation monitoring, structure, communication, leadership, and mutual support. So if we have those things in place, then we see that it's really effective to be able to implement this education plan. So like we said, partnership is really essential. And that means that we have to be able to think about what kind of project, program, and what type of community support is needed. This could be primary care providers, dentists, local schools, mental health providers, child care services, government officials, advocacy groups, private agents who are working in coalition building. And there are many forms of communication, and they really have to just be adapted based on the project and the community. And when we're talking about barriers here, we talked about a little bit about barriers. So communication barriers are really defined as circumstances that may impede progression of that educational intervention. And these could be ineffective leadership, goal confusion, lack of accountability and trust, members feeling they aren't contributing, and cultural age differences. Physical or logistical barriers can impede communication. So that could be electronic communication. That could leave more room for misunderstanding. Once identified this breakdown, when we figure out, okay, is it this, or this, then we can work together to reduce or overcome barriers. So through that communication, it can be clarifying, simplifying the goals, soliciting feedback, really demonstrating respect and understanding for each other. Extreme Ownership is a really amazing book. I recommend it for everyone to read. And this was written by a Navy SEAL who went into companies and would talk to them all about how to improve the effectiveness of what they were doing based on communication. And simplicity really was the big thing that he drove in, and as a leader, Extreme Ownership. So highly recommend it. It's very helpful for any walk of life in terms of nursing students, nurse, leadership, business, whatever it is. But it's looking at all of these different steps as well. Thank you.